Hi, I'm Dr. Armema Ataya, ASD school physician. Today I'm going to talk to you about COVID-19 vaccinations. You may ask, why vaccinate? Vaccines save lives. COVID-19 vaccines can protect us from becoming infected with the virus and from the serious complications and death. Reducing viral transmission in our community will flatten the curve and reduce the disease burden on our healthcare system. If we can vaccinate enough people in the community, we will get herd immunity, and that will eventually end this pandemic. Together, we can help our kids return to a more healthy, normal childhood experience, which is vital for their emotional and physical well-being. So what options do I have in Dubai? In Dubai, there are 3 safe, effective, and free-of-charge vaccines that are available: the Sinopharm vaccine, the Pfizer-BioNTech vaccine, and the Oxford AstraZeneca vaccine. The Sinopharm vaccine uses well-established technology where an inactivated virus is injected into your body, and this triggers an immune response which prepares you to fight the virus if exposed. The dosing schedule is 2 doses, 3 weeks apart, and the efficacy is excellent, 86% at preventing infection with the virus and 100% effective at preventing severe complications and death. You are eligible for the vaccine if you are 16 years of age or older, so please talk to your parents and your doctor about getting the Sinopharm vaccine today. The Pfizer-BioNTech vaccine uses a different technology, where mRNA that codes for the coronavirus spike protein is what's injected into your body. This makes your cells produce only the harmless spike proteins and trains your body to make antibodies to later protect you from the virus. The dosing schedule is the same as Sinopharm, 2 doses, 3 weeks apart. You have to be 18 years of older in Dubai to get this vaccine, and they're only vaccinating at the moment high-priority patients, so those who have chronic conditions, people of determination, those above the age of 60, and anyone who's a frontline or vital sector worker. The Oxford AstraZeneca vaccine is made from a weakened common cold virus that's been modified to look like coronavirus. None of these vaccines can actually cause the disease. The vaccine will prompt your immune system to make antibodies and prime your body to fight coronavirus infection if you're exposed. The efficacy is excellent, 76% after the first dose and 82% after the second dose, and it's 100% effective at preventing severe disease and death. It's also much easier to store. It's stable in a normal refrigerator. The dosing is 2 doses, 3 weeks apart, and you will be eligible for this vaccine if you're a vital sector worker, a frontline worker like a healthcare professional, people between the ages of 18 and 60 who have a chronic condition, and later on this will be opened up to the larger community. Exclusions. You may not take any of the COVID-19 vaccines in Dubai if you have had COVID-19 disease in the past 3 months. If you've had any severe allergic reactions to any components of the vaccine, if you're pregnant or planning to become pregnant in the next 3 months, if you're breastfeeding, or if you've had a vaccine within the past 4 weeks. Some frequently asked questions. What can I expect after getting the vaccine? Fever, chills, body aches, headaches, sore throat, soreness around the injection site, fatigue, nausea are all very common side effects. But the good news is this means that your body is getting ready to fight the infection, and they do pass usually within 3 to 4 days. Very rarely, severe allergic reactions can occur, so please talk to your doctor first before getting the vaccine if you have a history of severe allergic reactions. Will the vaccine make my PCR test positive? No, it will not affect your PCR result. But remember that you're not fully protected against the virus until 2 weeks after your second dose of the vaccine. And if you do test positive after having had the full 2 doses of the vaccine, you still are considered a true positive and you must still isolate for 10 days. Well, I've already had COVID, so why do I need to take the vaccine? It is very important that you still get vaccinated because much is still unknown about how long immunity will last for, and it is possible to be reinfected with the virus. Should I take a blood test afterwards to make sure that my vaccine worked? No, you do not need to take any antibody tests after your COVID vaccine, because the absence of antibodies does not mean that the vaccine didn't work. I've already been vaccinated. Now can I stop wearing my mask? Even after you have completed both doses of the vaccine, you must still follow all the strict public health precautions. You must still wear your masks in public, physically distance, and practice good personal hygiene. Because it is the combination of getting the vaccine and following these health and safety protocols that will end the pandemic. So let's do this. Let's get vaccinated today. Please tag ASD together. Thank you for listening.